This video is presented by College of Otorhinolaryngologists and Head and Neck Surgeons Sri Lanka to be used by medical students and medical professionals. This video shows how to do the nasal examination. Introduction and asking for the consent.
Good morning. I'm a fourth year medical student. Today I'm going to do a nasal examination on you. During this examination, I will inspect your nose and then use a medical instrument to look into your nasal cavity. You might feel some discomfort, but if you feel uncomfortable at any given moment, we can stop the examination. Would you like to proceed with the examination?
Yes, sir.
Before starting the procedure, wash your hands thoroughly using soap and water and dry up your hands. Then wear a pair of gloves. Then we start the examination of the nose. As of any other clinical examination, we start with inspection. You need to examine the nose from 3 different viewpoints. Those are anterior, lateral, and inferior views. The anterior view is used to assess the symmetry of the nose and other midline structures. Sometimes a line of light running along the front of the nose as seen here can be useful to clinically detect any deviation. From the lateral view, we are looking at the dorsum of the nose, the tip, and the angle that is made between the columella and the upper lip. This angle differs between male and female. In males, that is approximately 90 degrees, whereas in females, it is around 110. The inferior view is obtained by asking the patient to lift their head up slightly. From this angle, we are looking at the columella and the symmetry of the nostrils. Then we move on to palpation. At this point, you run your thumb down the dorsum of the nose, checking for any bony abnormalities and assess the degree of support at the tip. After this, you can check the patency of each nostril by covering it in turn using thumb and asking the patient to sniff in.
Can you sniff it for me, please? Relax. Okay? Relax. Using a cold metal tongue depressor, we can further assess the nasal patency. I'm going to check your nasal patency. Exhale to this. Good. In the next part of the examination, we are going to use the Tudukam speculum. We can hold this from your left hand index finger and use the middle finger in the front, ring finger in the back, and use your thumb to firmly grip and support the speculum. Then you twist your hand and direct the pointers towards the patient and use your middle finger and the ring finger to open and close the speculum.
In this, we usually retract the alar and look inside. You look at the septum, inferior turbinate, the middle turbinate, and sometimes even the postnasal space can be seen. Each nostril is examined in turn.